Welcome back to the channel. Make sure you stick around for the giveaway. Today, we are walking through a full, comprehensive patient assessment script. We have broken every step into its own section to help you memorize the flow for your exams or for medical role play. Let's start with the scene size up. 1. Scene size up. BSI and scene safety. U. I'm arriving on scene. First, is my BSI on and is my scene safe? Proctor. Your BSI is on and the scene is safe. Nature of illness. U. What is my nature of illness? Why was I called here today? Proctor. You're here for a 5-year-old child with a high fever and trouble breathing. Number of patients and backup. U. Is this my only patient? Also, I'm requesting ALS backup now. Proctor. This is your only patient. ALS is en route. C-spine consideration. U. Based on the information I have, do I need to consider C-spine stabilization? Proctor. No trauma is suspected, so C-spine is not indicated. 2. Primary assessment. Mental status general impression. U. What is my general impression as I approach the patient? Proctor. The child is in the tripod position and looks exhausted. AVPU and orientation. U. I'm checking their level of consciousness. Are they alert? And do they know their name, location, and the time? Proctor. The child is alert but lethargic. He knows his name and location, but is confused about the time. GCS, Glasgow Coma Scale. U. What is the patient's GCS score? Proctor. The GCS is a 14. He gets a 4 for eye-opening, a 5 for verbal, and a 5 for motor. 3. Primary assessment, ABC's airway patency. U. Is the airway open? Am I hearing any stridor? Proctor. The airway is open, but you hear high-pitched stridor on inspiration. Terminology. Stridor is a high-pitched whistling sound heard in the neck area, indicating a blocked or swollen upper airway. Breathing rate and quality. U. What is the rate and quality of breathing? I'm going to start high-flow oxygen. Proctor. Rate is 40 and labored. You see nasal flaring and rib retractions. Circulation and skin. U. Checking the pulse. Is the patient tachycardic? What are the skin signs? Proctor. He is tachycardic with a pulse of 130. Skin is hot, pale, and moist. Terminology. Tachycardic means a heart rate that is faster than the normal resting rate. Capillary refill and bleeding. U. Checking capillary refill and looking for major bleeding. Proctor. Capillary refill is delayed at 3 seconds. There is no major bleeding. 4. History taking. OPQRST. Onset and provocation. U. When did this start, and does anything make it better or worse? Proctor. It started an hour ago. Nothing makes it better. Swallowing makes it worse. Quality and radiation. U. How does the breathing feel? Does any pain move elsewhere? Proctor. His throat feels tight and painful. The pain does not move. Severity and time. U. On a scale of 1 to 10, how bad is it? And has it been constant? Proctor. He looks like a 10 out of 10 for distress. The difficulty has been constant. 5. History taking. Sampley. Signs and symptoms. U. What are the primary signs and symptoms I am seeing? Proctor. High fever, drooling, and obvious respiratory distress. Allergies and medications. U. Does he have any allergies or take any daily medications? Proctor: no allergies and no current medications. Past medical history. U: does the patient have any significant medical history? Proctor: none. He is usually a healthy child. Last oral intake and events. U: when did he last eat and what was he doing when this started? Proctor: he last ate at breakfast. He was playing normally when the fever spiked. 6. Secondary assessment, physical exam, head, neck, and chest. U: checking the head for drainage, the neck for JVD, and the chest for equal rise. Proctor: no JVD is noted. Chest rise is equal but shallow. Terminology: JVD, jugular vein distension, is bulging of the neck veins, which can mean the heart or lungs are under too much pressure. Abdomen, pelvis, and extremities. U: palpating the abdomen, checking the pelvis, and checking all 4 limbs. Proctor: the abdomen is soft, the pelvis is stable. All 4 limbs have weak distal pulses. 7. Vital signs, blood pressure, and pulse. U: I need a full set of vitals. What is the blood pressure and pulse rate? Proctor: blood pressure is 90/60. Pulse is 132 beats per minute. Respirations and SpO2. U: what is the respiratory rate and the oxygen saturation? Proctor: respirations are 38. The SpO2 is 94% while on oxygen. 8. Field impression and transport. Field impression. U: based on the high fever, drooling, and stridor, what is my field impression? Proctor: your field impression is a pediatric patient with suspected epiglottitis. Transport decision. U: this is a high priority patient. We are initiating immediate transport. Proctor: correct. This is a load and go situation.
9. Reassessment 5-minute checks. U: I will reassess the patient every 5 minutes. Are the ABCs still the same? Proctor: the patient's level of consciousness is decreasing. He is becoming very sleepy. Radio report. U: I'm calling the hospital to give my report and ETA. Is the hospital ready? Proctor: the hospital is ready and waiting for your arrival. U: and that is a complete step-by-step patient assessment. Thanks for watching.